Dear colleagues, the proposal for a Critical Medicines Act is an important initiative. It seeks to strengthen the resilience of our pharmaceutical supply chains and protect patients across the EU from future shortages. We share this objective, but from the perspective of smaller and lower GDP member states, including Bulgaria, there are concerns about the direction taken in Chapter 4 of this proposal. The legal basis of the Act raises uncertainty. The current reliance on Article 114 of the Treaty on Functioning of the EU alone, without an impact assessment, is insufficient. At the very least, a dual legal basis combining Articles 114 and 168 could be used as established in the Health Technology Assessment Regulation. The mandatory introduction of procurement requirements beyond price-only criteria, such as resilience and sustainability, may disproportionately harm lower-income member states. While these criteria may sound appealing, in practice they risk increasing pharmaceutical costs, diverting scarce resources from other healthcare priorities, and limiting affordability for patients. Such measures should remain optional, not compulsory. On collaborative procurement, I think we should support cross-border initiatives between like-minded countries with similar needs and budgets. Regional cooperation can deliver real benefits. However, centralized Commission procurement, as foreseen in Articles 22 and 23, poses serious risks: price convergence, pressure on national reimbursement systems, exclusion of smaller manufacturers, and contracts detached from national realities. Unless strong safeguards are introduced and unless participation is truly voluntary, these provisions remain controversial, in my opinion. Finally, the requirement for national programs within 6 months of entry into force is neither realistic nor proportionate. Without clear analysis of data, such obligations threaten to burden health systems that are already under strain. Member states must retain the right to decide voluntarily if and when to introduce such programs. In conclusion, the Critical Medicines Act must aim to strengthen Europe's pharmaceutical resilience while taking into account also the diversity of our healthcare systems. For the Act to succeed, it must offer flexibility, fairness, and real subsidiarity. Thank you.